what more is there to add? We've had some outstanding speakers, outstanding interventions from the floor, and it's been said, hasn't it? And what we've been doing is capturing the key recommendations and conclusions as we've gone through. I'm not going to go through it all, because what we need to do is to synthesize that and aggregate it and condense it into key conclusions and recommendations over the coming days. But if we, I thought I'm in control here. I just wanted to take us back to where we started, which was the objectives. It was about raising awareness amongst the stakeholders involved in the reporting, evaluation and prevention of medication errors. It was about building a common understanding of what constitutes a medication error, and also understanding that there are new legal requirements for reporting cases of medication error at EU level, and that brings opportunities both at EU level but also for collaboration within the member states. We wanted to have a better understanding of how medication errors are managed at national level, so that we can potentially start to develop best practices, and that then we can share those best practices for the prevention of medication errors. And finally, perhaps make proposals to facilitate stakeholder cooperation at national and international level. I think we have made good progress against all of those objectives, and I hope you'll agree. That you're not meant to read this, but this is a very first draft, and it runs to about 8 pages of what we have been capturing during the course of this meeting. So just to give you a flavour, if you go into definitions and terminology, there's a need for a common operational definition of medication error. This will support prevention strategies, detection, reporting, classification, and underpin research efforts. Any new definition of medication errors could be tested before full implementation, etc., etc. We've been capturing these as we've gone through, and we're not going to go through it because on a Friday afternoon, 8 pages of slightly raw recommendations might be too much to digest. But I just want to reassure you that we've very carefully been capturing the key recommendations and conclusions as we've gone through. What about moving forward? What might the outputs of our work over the last 2 days be? And again, this is very high level, and we'll need to analyse it further and come up with, if you like, a work programme on moving forward. But firstly, we will make all of the presentations available on the web. That should happen in the next day or two, so that you can download them, make them available, send the links to your colleagues so that you don't have to write such detailed notes, if you like, of the workshop. The information will be there to share. We will also write a formal workshop report, and we'll try and do that within weeks rather than months. And that will be then a formal record of the meeting, and particularly the key conclusions that come out of it, which then fits in with the next bullet point, which is key recommendations. Probably this will be in the context of the report, but I have to say there's been an enormous richness that's come out in the workshop as to what might be some best practices, what might be recommendations for moving forward on bridging between patient safety and medicines regulation, what might be key recommendations on bridging between European level work and national level work. And in that context, we might want to consider what might be best approached at a national level. So at a European level, we don't get involved particularly, perhaps we just share information, and what might actually be added value of acting at a European level. Perhaps to fill gaps which can't be well addressed at a national level. Having listened through all of the presentations and thinking specifically about the medicines regulatory world, there's been lots and lots of very practical suggestions on classification, on terminologies, on search criteria to analyse the reports of medication errors that come into medicines regulators, on getting feedback from local practice on reducing medication errors if we're going to design a centralised risk minimisation strategy for a particular medication error. All of this, and there's just 3 or 4 examples, I think are very practical, and we can try to analyse it and embed it into our normal work processes. And I think that could be done quite quickly. And then the final output, I would hope, will be an ongoing dialogue. And I was very encouraged by Agnieszka's suggestion that we might have some sort of cross-fertilisation between the European Commission's Patient Safety Working Group on the one hand, and perhaps we can think about the best forum, perhaps the observership, when there's relevant issues at the Pharmacovigilance Risk Assessment Committee here within the European Medicines Agencies. This has got to be good for public health, and I'm sure we can find ways to make it happen. So Without going into all the details, I would just like to thank all the speakers for sharing their expertise and experience. I'd like to thank all the chairs, the programme committee for putting such, I think, a very rich programme together. I'd like to thank my EMA colleagues for the logistics coordination programme development that has gone into such a successful workshop, and particularly Thomas Gerdeker, Ava Rossi, and Henry Fitt for putting this all together. And finally, I think to thank you, all of you, for your efforts and your interest and for caring enough to come to this workshop. So a final comment. I think we're all working together for public health. So thank you very much. Have a fantastic weekend. And we can do better and we will do better. Cheers.